so I propose we go on with our program. We have now our second panel, and we have three speakers from Portugal, from Greece, and from Hungary. From Portugal, we have on the screen Alexandre Lourenço. He's the president of the Portuguese Association of Hospital Managers, and he works as a hospital administrator at Coimbra University and Hospital Center, the major hospital in Portugal. Alexandre Lourenço is also involved in the work of the World Health Organization, of the WHO, and also in the work of the European Association of Hospital Managers, and he is a member of our executive committee. So, Alexandre Lourenço, the floor is yours. And first, I propose you give us some explanations about the situation in Portugal nowadays, today, and comparing with the situation at the beginning of 2020. Thank you.
So thank you so much, Mark. I have a presentation, but I can start with what you are requesting. Actually, I believe that we are starting a second wave. At least there is an increase. I'm hearing something in the back. And we are probably entering in this second wave. The incidence is increasing, but I will try to show you what we have done since the beginning of the pandemic, and with this kind of narrative where we could follow what we have done in Portugal and what we expect to happen soon. I believe that you are seeing my screen now, and thank you so much for having me on this forum with other colleagues. So we started with a situation of uncertainty and the need to adapt the healthcare system to this pandemic. I will be quite fast in this part, but actually in Portugal, after we saw what happened mostly what happened in northern Italy, actually in Portugal we confined and introduced confinement measures, these physical distance measures, before the first death in Portugal. So I must say that in Portugal, I believe that we had a mild problems with the infection, and probably most of the problems that we are having are not related with COVID at this point, and I'll try to show you some studies that we have done. But actually we started these confinement measures earlier than other countries, as I told you, before the first COVID death in Portugal. So actually we have this mild pandemic. So the kind of scenarios that we have seen in Spain or in Italy were not seen at all in Portugal. But what we understood is that our capacity of hospital managers is quite dependent in the community response and on the individual behavior of everyone. So we understood clearly that most relevant to allow us to provide adequate care was to implement these measures at the individual and community levels. We started mostly also most of the countries to start this communication with the population to clarify the first point of contact. So we started in Portugal. Everyone knew that they needed to contact our helpline. Actually, in the beginning was quite a mess. Our helpline, our health system helpline was quite overwhelmed. And after we increased our capacity and things started to work perfectly. So before someone come to our emergency room with suspicion of COVID, they should go to call this helpline, and it worked quite well. Also, we define what could be the entry points in the emergency care. We defined two major hospitals in Porto and in Lisbon to receive the first cases, and immediately we create this dual pathways for respiratory conditions and non-respiratory conditions at the emergency departments, and also that worked quite well. From those first two designated hospitals, we evolved to a second level group of hospitals, and then all the network was engaged. Most of our work was related, and our most concern was related with intensive care. And actually, we that was a problem, I think, in every country, at least in Western Europe. And actually, we most of our elective activity was stopped, postponed, and actually, in some hospitals, we even used our operatory rooms to hospitalize COVID patients that needed to have mechanical ventilation. So we use all the resources that we have. Even in my hospital, we identified nurses that had experience in intensive care, because even our current intensive care units work below the need. So we identified nurses and intensivists that were working in other areas of the hospital and not specifically at that point in intensive care units. Also, most of our strategy was organized for expanding services to home. Actually, we hospitalized less than 10% of overall number of COVID cases. At this point, I believe that we are in 5-6% of the cases that are hospitalized. So we developed also home services. There is, since almost the beginning, an app where we can, that is called COVID Trace, that family doctors follow patients remotely. And this app was also very, very relevant and continues to be. Anyway, we continue to maintain this continuity of essential services, but we free up our capacity, as I told you, in by hailing down the surgeries and also medical appointments in our hospitals. And then we train and repurpose and mobilize healthcare force, of course, according to priorities. And at the beginning, I must say also that we had lots of problems in access to personal protection equipment. In beginning of March, there was lots of concerns on it, and he started to mobilize also community resources, where several companies also supported hospitals in developing and providing even gel for the clinic gels and all the PPEs that you can imagine to support hospitals. So the community was quite relevant at this point, where most of the goods that would come from China were held also by the pandemic. What we started also, even in my hospital, in other hospitals, is to anticipate and address these mental health issues. Mostly in our professionals, we created this psychological helpline also for professionals and also for the community. But most of our concern, at least in my hospital, was directed to healthcare work, our healthcare workforce that was on the front line. So we created these phone lines to support, psychological phone lines to support healthcare workforce. I must say that in the beginning, most of our nurses and doctors, I don't know if it was like that in France, but they were completely mobilized, and there were recommendations not to be in contact with their families. So we created also this kind of structures where they could stay, and of course, being far from the family, and all that created this kind of additional stress. So most of our response, I must say, that is about flexibility and preparedness. We even created new units in our hospitals, mostly in the emergency rooms. We built even this new structures for responding to this first level of crisis. And even and you can see in the right, for example, a CT scan that we implemented in the hospitals, just dedicated to COVID. And even this was a project that I was involved with the European Commission, where we could, with artificial intelligence, diagnose also COVID by the CT scan. And as you remember, the tests were quite slow at that time, and we needed to wait at least for 24 hours to get the result. So this was quite important also at that time. So our role at the hospital at the beginning, we started always to this multi-level approach. Asymptomatic, they stay home in quarantine. Mild cases, they go home. As I told you, they are more than 90% of the cases. Moderate cases, severe cases that need oxygen therapy, and critical cases that need mechanical ventilation. This was mostly our approach, our clinical approach to the cases, and we developed clinical pathways for each one of these clinical stages of the disease. The Portuguese Association of Hospital Managers, we also developed, and it's available, and a tool that is being used worldwide. This is the Adapt Search Planning tool. That is a tool that we developed for WHO and was adopted worldwide, and you can download it, but from the World Health Organization website, that help to predict the evolution of the pandemic, and also what are the resources that you need, like hospital beds or even nurses or physicians. At this point, the tool also allows you to predict second waves and what would be the resources for second waves. And also, actually, at this point, the tool is also predicting the resources for home care and even contact tracing. So I engage you if you want to use this tool. It's not so easy, but you have a manual to use it. But it was developed by us and endorsed and used worldwide by several countries that are using it now to predict second waves and the need of resources for second waves at this point. Also at the Portuguese Association, we realized that was quite hard to get training and information, and good information, good quality information across all the providers. So we developed several webinars at the beginning, and still training webinars that we engage also with the health internationally, with the World Health Organization, but also with Brazil, with African countries, and of course locally, and with our neighbors from Spain. So several webinars. I must say that we are millions of views at this point, and all these webinars are available in our YouTube channel from our Portuguese Association of Hospital Managers. We also released these two special editions of our journal. One in the left, you say thank you in Portuguese, obrigado. That was dedicated to healthcare professionals, and the second one also one mostly to narrate what happened previously, and the second edition was mostly thinking on the future and what we need to do on for the future, and how to prepare the system for second waves and afterwards. We also started and accelerated a program on training in this idea of going digital. We have an academy for healthcare managers in Portugal, and we moved this academy, this training program, to digital. And you see in the right, one of the programs that we developed, that is business as unusual. So mostly to train managers and healthcare managers, hospital directors, and system change and dealing with crises and new problems, new talents. So actually now we have more than 10 courses, online courses that healthcare managers, and actually they are open to all healthcare professionals. They are open, and you can have access to them on training programs remotely. So we change our training programs to this remote. Also, we developed awards. Actually, we have more than 100 applications for this Healthcare Excellence Award Special Edition for COVID. We also give face masks to all our members, and they were distributed in all hospitals. One of the issues that we are very concerned in Portugal is the issue about bed blockers. Annually, we have a survey of bed blockers. This is the overall study that we have done, but we did a special edition also in bed blockers for COVID patients, and we realized that 20% of the COVID patients that we have hospitalized, they didn't need actually hospital services, so they could be treated elsewhere in extra hospitally institutions. So this is one of the issues that actually we are dealing now with the second wave, is to try to have this backup hospitals or backup structures to allow us to increase our hospital capacity by reducing the number of bed blockers with COVID. So the issues that we realized from all the COVID situation is most related with this the need to replace frontline healthcare workers. We believe that they are tired. I don't know how they are going to answer for the second wave. Also, we are concerned with mental health disorders due to confinement and also for the human resources burnout. I will show you, at least from our knowledge, the idea that we are going to have an increased need for hospital and healthcare services due to cancellation of our elective activity, and also the increase of unemployment and poverty will also, of course, have an effect in the needs of our population. And actually, hospitals at this point are running with higher operational costs due to the use of PPEs, regular testing. All patients are getting testing, chronic patients, surgical patients, they are getting tested. So this is increasing our costs. We increase all the clinic routines also in the hospitals. And of course, we have a reduction in our productivity due to the all new activities that we need to implement in our hospitals. Concerning with this, the Portuguese Association of Hospital Managers and the Medical Association, we publicized, we did a study. This is in Portuguese, but mostly what we have tried to analyze is the reduction of access to care due to COVID. And not to COVID patients, but to non-COVID patients. And this is quite one of the issues that we are more concerned with. We have seen a reduction in the activity of primary care. Even in hospitals, we are seeing reduction in the referrals from primary care. And we believe that most of the diagnoses and initiation of treatments, they are being delayed with, of course, some consequences in morbidity and mortality of patients. We see this is also in secondary and tertiary activities. We have saw a reduction in 40% of our medical appointments, 24% of our surgeries. We have seen a reduction also in our emergency rooms. So we are really seeing an impact for non-COVID patients. I must say that also we realize that in our emergency rooms, we have seen a reduction. I don't know if some countries use the Manchester triage in emergency rooms, but what we are seeing really is something damaging in the most complex cases. So mostly in the red and the orange and the yellow cases, that we see a major reduction in the emergency room attendance with consequence to the patients. What we believe is that patients are afraid to come to hospitals, and that's why we developed a campaign. I will, bear with me just a while, just to show you a campaign that we developed. I will try to have my sound with you.
COVID-19 has put protection on the agenda. And if you're protected on the outside, you should be protected on the inside. So, do not mask your health. Pay attention to your symptoms. Keep doing your treatments and necessary tests. Neglecting your health can become a serious issue, and fear is still the most dangerous of diseases. Remember that seeing a doctor is still necessary and safe. Always wear a mask and make your health a daily priority. A recommendation from the Portuguese Medical Association and the Portuguese Association of Hospital Managers, supported by Roche.
I don't know if you had the opportunity to see it, but this is a campaign that we release in the media. I hope that you saw it, because I never know with the technology. We developed this campaign mostly also to in the social media and on TV to engage patients to not be afraid to come to the hospital. So this is a major campaign that we are quite engaged with. We also have done studies in the consequences of a second wave, and if you are not prepared, and also we need to postpone elective activity, and we see major consequences in access to care. So we are quite concerned in the next few months about this. So most of our strategy is to continue to manage this dual system, this dual pathway system, where we can catch up cancel activity by the increase of e-health, and we have a major increase on e-health utilization, but also to maintain this flexibility, COVID, not COVID, to maintain this balance between services. What we believe that actually this is a serial killer. We are afraid, of course, all the respiratory diseases that are going to emerge due to the cold weather, and we are, of course, afraid what and concerned what can happen in the next few months, knowing that this uncertainty will continue to put additional pressure in our system. But we hope for the best, and I also hope for everyone that is also on the call and worldwide to manage this situation the best that they can, because it will not be easy at all for any one of us. Okay. Thank you.
Thank you, Alexander Lourenco. As we could see, there are a lot of things we can improve, and also on the level of hospital and health management. Maybe there is just enough time for one question. Philippe?
Hello, Alexandre. Perhaps one question. Your country have a very big border with Spain, and in Spain there is a lot of people who have COVID and died of COVID, and not a lot in your country. How do you protect your country about about the COVID?
No, what I try to explain is that actually we implemented the physical distance measures before the first death that we had. We have secondary infections. We believe that we didn't have direct infections from China, and so most of our first infections came from northern Italy. So we had the time to implement these confinement measures. At this point, we have lower levels of incidence of COVID when we compare with Spain. Even in Spain, what we see is lots of pressure in Madrid, not in the overall country. But of course, we need to be aware that we are living in a global community, and what we are seeing, and without the possibility or the political possibility to implement confinement or the strict confinement measures in the next few months, we need to be, at least at the hospital sector, quite concerned about what is going to happen in the next few months. What I also believe is that hospitals are quite dependent in the behavior of the community and in the behavior of other healthcare services like primary care, advanced posts for diagnosing COVID. We continue to have drive-thrus, I think, for diagnosing COVID. It is planned to have these advanced posts for respiratory diseases. But anyway, I believe that we are going to face something that you never have seen, and probably the impact in Portugal in the next few months will be much higher than what we have seen in March and in April, that it was quite mild when we compared what happened in Portugal with Spain or with Italy.
Thank you, Alexander Lourenco. Now it's time to switch to Greece. Our second speaker is Georgia Oikonomopoulou from Greece. She is a senior management staff at Ellipse Athens General Hospital. And Georgia is also a member of the board of the European Association of Hospital Managers and of board member of the Hellenic Health Services Management Association. Georgia, the floor is yours.
Good afternoon from Athens. I have to say that my friend and colleague, Alexander, gave us an effective hospital manager feedback and hitting all the right points. Undoubtedly, as the new decade began, while I'm trying to share my screen, give me 1 minute. Well, okay. As the new decade began, as I was saying, everything rapidly unfolded into a scenario that the world will be remembered for years to come. We're experiencing an unimaginable global viral pandemic of zoonotic origin that our collective imaginations over the coming years will be overshadowed by a virus that took fewer than 100 of days to shut the world down. As COVID-19 swept across Europe, Greece started implementing nationwide measures to contain the virus, including cancellation of major public gatherings and lockdown measures. And that measures went along with healthcare system in ICU capacity, tracing, closed to home unit services, and many more. In summer, we reopened the airports to international travelers, of course, with restriction of flights from countries considered high risk were and still remain in place. It was in the hopes of salvaging this year's tourism season and easing an anticipated recession caused by coronavirus lockdowns. I'll first show you some data about Greece and the country's highest rise since May. This is from the last 15 days. But data is still encouraging, with countries' death per 100,000 of population to be at the lowest in Europe. And that even if we are concerned with the recent spike in coronavirus cases and have set up mobile units to conduct more rapid tests. Athens, sorry to tell you that, remain the epicenter of the new infections. The way we have experienced and viewed healthcare has changed over the last 9 months. And organizations are looking for ways to address new unexpected challenges at rapid speed. Our additional challenge is to cope with COVID-19 cases of refugees and migrants. According to virus estimates, about 150,000 displaced persons are located in Greece. In the existing camps, measures against the spread of the coronavirus are lacking as people live in overcrowded spaces. By late of September, half of the COVID patients in 2 major hospitals of Athens were immigrants. There are 3 main topics of challenges in healthcare delivery and reduced spread, and those are communication, continuity of care, and confidence. But these very harsh times have taught us that the best outcomes always comes with collaboration and consistent efforts. When government authorities and hospital organizations join efforts, the results are better, as together we can open a safer umbrella towards marginalized population. In this battle against time, no one is to be left behind, and Greece is proving so. I very well know that it's unorthodox to conclude before develop the points, but this is the core message. If we take care of our staff, then the staff will take care all in need. This is the message that my colleagues in Hellenic Health Services Management Association took from this pandemic. Next lesson is encouragement. It is essential for health workers to see leaders present. Staff must know you and their organization truly care for their well-being, guide, help when is needed. Keep contact and telephone in staff that is in quarantine is a key factor to ensure people, healthcare forces, that you care. And of course, continuous update in preparation and hospital emergency planning. And we all know that the very resource-limited circumstances is a huge, huge challenge. Thousands of healthcare workers lost their lives as a result of hospital-acquired infection. Last estimation was about over of 7,000 workers that have died. It's our responsibility for taking care and protect the staff. For example, assuring PPE supplies needed to be managed, of course, carefully and enough to make employees feel secure, or provide regular breaks for rest. I know this is very difficult, but it was one of our association promotion. As long as with psychological employee support by employing mental health specialists on call. Last but not least, training and training. Find the right and important information that staff needs, communicate it to all on a regular basis. And of course, listen, sharing thoughts, sharing concerns about the situation is crucial to ensure that staff trust you. A good and direct and clear communication may reduce a lot of fears. At Hellenic Health Services Management Association, as the pandemic continues, everything we do looking at connecting these dots between experience management and an operating framework to help hospital managers in minimizing risk to patients and healthcare personnel. Along with colleagues in European Association of Hospital Managers, are waiting for COVID-19 to become that game changer, a game changer in awareness for hospital workers' safety. Thank you for listening.
Thank you, Georgia. Thank you. It's sometimes difficult to manage time, and this afternoon we are a little bit late.
I was very short here, Mark.
It's not your fault, huh? But we have to manage it here. So I propose there's certainly questions for you. You have the possibility to ask the questions on your screen. Or by using the email address of the site of the conference.
The SHeIC.utt.com. Yeah, this one. Yeah, this is the good. You have it in the is in the www.SHeIC2020.com. You can go and you can send your email if you need. No? Okay.
Okay, so we propose to go on with the other speakers. Thank you very much, Gogo. And you will receive the questions by email or directly on your screen. So the next speaker is from Hungary. It's Dr. Lajos Ari. Lajos Ari is a medical doctor, and very important, he's also the head of the local scientific program committee for the 29th EHM Congress, the Congress of the Association of Hospital Managers in Europe, which will take place next year in September, October in Budapest. Dr. Ari shows us slides in German, but I think it will be possible to translate the slides later, so we can put them on the site. I think you will speak German. Do you hear me?
Yes, I hear you.
Yeah, okay. Do you speak in German or in English?
My English is too good, but I try to speak English.
Yes, if you can, please try to speak English. Otherwise, I will try to translate.
Okay. We make so what is too simple.
Sorry, we have some problems with the sound.
Okay. Now, is it now better? Hello, is it now better?
Yes.
Yes, it's better. Can I speak? We understand nothing. We don't hear anything.
Yes, I can hear you. Ari, Jerry,
yes?
In Ireland, yes, I can hear you very clear.
You hear me very clear.
Yes.
Okay. Then I begin English, and if I have difficulties, I continue in German.
Okay, the floor is yours.
I am the last speaker, and I thought my idea was to make a summary. The idea was for me, I am retired, and the two speakers spoke very exactly what must we do if we have a pandemic problem. Everybody in each country is the way quite the same. It depends from the only from the around of the hospitals, and this is why my idea make a summary, a global summary. He is the hero, and we can imagine what can make the policy with a doctor if he talk but don't feel is good for the politics. I made a balance. Each money has two sides, a positive side and a negative side. The negative side only shortly, the many tragedies all over the world. But it's very important, the vulnerability of the world, global, regional, or in certain counties, in the ecology, in the economy, in the healthcare too. You can imagine what I mean, the human resources, the technical side, the orders, the waiting list. We haven't therapy, but it has positive sides too. Our colleagues made a very strong work. They were extraordinary. And the vulnerability, it is a mirror. We can see in the mirror what is wrong in our world. And it is time to reboot our world. The innovations, the cooperation between the pharma industry, in the informatics, in the healthcare, all over the world. I remember many people are going from one country to the other at the beginning of this pandemic. They got help. The fake news is a very big problem. The panic on the population. The quarantine, the closing of the borders. If Hungary closed the first time the border between Austria and Hungary, it was a big problem in Austria in the healthcare. Doctors and nurses can't go over the border. Any days were there a big problem. The problems in the economy, the mental status of the peoples, the testing, how, with what kind of tests, the price of the taxes, what is the positive side, the international cooperation, the work of the WHO. The big population was there, had made discipline. We had the masks and the social distances. Many private initiatives, the cooperations, the new attitude of the pharma industry. They make the development, the research together. The next. Now, two pictures about the quarantine. You can see two cards. One is from made in Hungary, and the other is from the European Union. I know this is first time the quarantine and to close the border. It's to protect the countries against the sickness, but it is politics and economical toy too. And this is very important, the facet. What can we learn about that? Our life must be changed. The first sentence, what you see with the red scripts, is the Hungarian linguistic game. You can see that the traduction, Freiheit ist nicht gleich Ungebundenheit. Demokratie ist nicht dasselbe, dass wir Dummheiten sprechen können ohne Kontrolle. Und bitte mag das so zuerst übersetzen. Es muss klipp und klar festgelegt sein, wie man kann, muss die Gesellschaft, das Gemeinwohl, das Recht des Individuums einschränken. The responsibility for the peoples and for the social media is very important. First time, the fake news. The second time, don't give place for the virus skeptical. Don't give place for the people who don't want to get and that speak against the vaccinations. We must think about the globalization. The healthcare and the social work must be much stronger. We have problems in the structure, with the human resources, with the infrastructure and the financing all over the world. Some countries have a better structure, other has a not too good structure, but the financing is everywhere problems. The education and the post-education must be most nearly the praxis and must be more flexible. We must educate the people who are sitting before the TV and listen to the radios, they read the newspapers. The patient's education is very important. We must think about the politics in the economy. We must learn how we must work, and we must reboot the industry. Not everything must go to the Eastern. We must work. We must make many things at home too. The world is not. Die Welt ist nicht unsere Welt. Das haben wir nur von unseren Nachbarn geliehen bekommen. Also wir müssen auf die Welt aufpassen, protect the environment. I want to make a little bit travel in the time, und das würde ich, and that's why I speak in German. Die Gesetze sind nur dann brauchbar, wenn ihre Misshandlung geahndet wird. Ein Beispiel der Quarantäne. Die Kaiserin, Königin, hat 1770 der Generale Normativum Reis Sanitatis geschrieben. Das war ein Gesetzbuch für das ganze Reich. Da waren viele, viele Kapitel über die Quarantäne. Die Quarantäne war damals gegen Pest 48 Tage. Aber wer das missachtet hat, der wurde sofort erhängt. Die Todesstrafe. 1867 hat das Ungarische Reich dieses 14. Gesetz entlassen. Das war der erste große Kommunalgesetz in Ungarn. Ich habe das Ganze durchgelesen. Es ist so gut geschrieben, dass wenn wir es jetzt ein bisschen erneuern würden, in der jetzigen Sprachenwendung, würde es 100% passen. Die ersten 8 Paragraphen waren die Strafen und 10 Paragraphen waren über die Seuchen und Infektionen. Was wichtig ist, Quarantäne war damals hauptsächlich in den Krankenhäusern.
You say the first.
Dann bin ich fertig. Das erste Bild zeigt ein Quarantänezentrum 1937. Das musste der Familienchef, also der Vater, auf der Tür kleben. Und da kann man sehen, wenn die Quarantäne nicht hält, der musste 600 Pengü bezahlen. Das waren 3 bis 4 Monate Gehalt eines Angestellten. Also die Strafe war klipp und klar. Das ist, was wir jetzt dieses Jahr dann aushängen müssen. Da siehst du die Paragraphen, aber wir wissen nicht, was die Strafe ist und wo wir diese Strafen finden können. Und danke für Ihre Aufmerksamkeit. Merci beaucoup. Thank you for your attention.
Thank you very much, Lajos Ari. So I wanted to say about the last slides. You insisted about the penalties.
Yes.
And in the past time, there was more text about penalties than about care. And now we hope it will change. I'm sure we have a lot of questions also to you, but as I said before, we will send you the questions by mail, or you will receive them on the screen. And don't forget, we have next year, let's hope, our Congress, EHM Congress in Budapest. So we can meet you in Budapest, and I'm sure we will have also a lot of things to discuss about COVID during the Congress in Budapest. And let's hope the situation will permit us to come to Budapest in September, October next year.
We hope
Thank you.
that you consider one of our speakers.
We don't hear you.
Zsuzsa Jakab, the Vice Director General of WHO, is one of our guests. And we plan with the mental committee a program about the post-trauma effects of this pandemic.
Okay, so I invite everybody to look at the
Invite everybody.
Congress next year in Budapest. Yes. Okay, thank you very much, Lajos Ari. So now we come to our last